So the question was, yeah, where are we now with nurse specialists, and what is the, yeah, what is the future, and what way to go, and what are the required steps? I will give you my opinion. I don't think there are many ways forward, but I think, as Nigel Lord Crisp was saying, I think the future is bright, and it's also the theme of the conference in creating the future. I think to do that, we have to go look back and to see where we are. And I think what I would like to do is to focus on the role of nurses and also specialist nurses during that COVID-19 pandemic we are in, because I think it's important to understand where we are and in which way we go, and then some instruments that are provided by the European Commission to work on that. So I just want to refrain some of these steps that can be taken. But let me guide you to the COVID-19 pandemic. We all know there are different phases in this pandemic, and the first thing what we should do is of course prevent, and so we have to prevent to become sick. There are some different measures, as you all know. It's like social distance, mouth masks, hand hygiene, ventilation, and the new thing coming up is in vaccines. So that's the first thing to do. Of course, we have to screen, because some people can become ill, and that's what we do with testing, contact tracing. We put people in quarantine. If they become sick, then we start with the treatment. Most of these people can stay at home, so the disease is mild to moderate. They stay in self-isolation at home. They might be asymptomatic, or they might have some symptoms, but altogether it's mild and rather moderate. But we know that some people are admitted into the hospital, have some disease problems, certainly in breathing, and some other problems, and some of them end up on ICU, have some critical care, or need some critical care. Altogether, when we look to the data, I think altogether in Europe, 95% of the people in our community stay healthy. We have about 5% of the people that become ill. What is a low number still? And so the number is varying from country to country. So I'm looking to the numbers all over Europe. It's about 1% in Finland. So not many people are getting infected over there, up to more than 11% now in Czech Republic. And that did severely hit, as we all know. And just to give you complete the data, about 80% of the patients or the people get mild to moderate symptoms or no symptoms at all. Only 20% are admitted into hospitals. And from that 20% that are admitted into hospitals, about 5% are getting into ICU. And so the death rate, case fatality rate, is about a little bit more than 2%. Of course, this depends severely on your age groups or comorbidities and so on. So when you're a little bit more obese, or you have some comorbidities, this infection rate or this rate can be a little bit more. One of the most interesting publications I've read during the last year is a publication by Imperial College in March 26. And so it's about the estimates. And I just want to tell you about the estimates. And the estimates were then by Imperial College. We estimate that in the absence of interventions, so if we do no prevention, if we do no treatment and so on, so because that's an important type of data, COVID-19 will result, and that's all the data for Europe, for the European Union, in fact, this will result in 391 million infections for Europe. So it means that 88% of all population would be exposed, and 4.4 million deaths in the EU this year. And looking to the data now, and I checked the data yesterday on Worldometers, we have 22 million infections and a little bit more than 500,000 people being died from the disease. Of course, every person we are losing, it's a tragedy. That's how it is. But I think, and it's important to know, and it's important to reassure, and I think that's the role we are taking as the health community and as a full community, that we saved 3.8 million lives in the EU by all the measures we are taking. And I know that most people are focusing always on the negative things. Of course, I think these prevention measures are not quite nice to do. The lockdowns are not quite nice. The evening clocks are not quite nice. It's of course it's a catastrophe when you're losing a patient in intensive care. But we have to know, and that's the result of our efforts, that we saved almost 3.8 million lives until now. 88% of the population was saved. And I think it's quite important to say that. And so this is mainly by the role we are playing in our healthcare system. So it's of course not the role of nurses alone. It's a role of social services. It's a role of communities. It's a role of people that take a responsibility about their own health and are really, really be very careful. It's the role of doctors, it's the role of physiotherapists and so on. So it's a whole community, but it's also the community of nurses that is really contributing to it. And I put a few examples over here. I see community nurses do an incredible amount of work in working with communities, with people. They work on public health. They really are teaching people why this is important, how they have to wear masks, how they have to wash their hands, what ventilation means. They're now actively involved in the vaccines. They are involved in the testing, in the contact tracing, in the quarantine. They are working with people at homes and checking if they are doing well. And then we have our heroes in the hospitals, dealing in the ER nurses, respiratory nurses, infection control nurses, ICU nurses, rehab nurses. And we see all these connections, also these people going into nursing homes and at the home as well. I see in this country, in my country, in Belgium, that a lot of infection control nurses were going into the nursing homes and help their colleagues how to deal with prevention, how to take some protective measures. So I think this is the community that's existing. And so out of that, I think this is where we are going into the new paradigm. So the new paradigm is not 2030. It's not by accident 2030. It's a new health paradigm after COVID-19. And I think COVID-19 is really a stress test for the healthcare system and for the whole community. And so I see some shifts going on. I see some shifts from the medical dominated healthcare system into more interprofessional teams. I know that in the past, healthcare was very focused on hospitals. What I see now, it's moving into integrated health networks, including prevention, including being at home and keeping people at home healthy as long as possible. And only when that is not possible, we can bring people to hospitals. But it's a complete other mindset, how we look to the healthcare system. We are dealing with populations, not only with individuals. We're putting more effort on prevention. That's what I learned certainly in COVID. So the biggest impact is in preventing people to become sick. That's what is the most important thing. When they become sick, of course, we have to handle, we have to take measures, but preventing them to become sick. And then, of course, the full impact. We are talking about health. And so in our country, we are talking about the power of the virologists. But at the same time, we see all these psychiatrists, psychologists, and so on, really working with people, talking about their well-being, about economical consequences, and so on. So it's a total community that is involved in when we are talking with this crisis. It becomes very proactive, evidence-based. We are talking about the data every day. And I think there was no crisis before that was so documented as this crisis. We are really looking to mortality. We are looking to complication rates and so on. We are following the infection rates day by day. And it's really not about the professional, but it's mainly about citizens and patients. And it's about behavior and change. So we are saying in the healthcare arena, what we think is in 2030, we'll have to behave differently. We learn how to a new life, and that's what we see. And coming back to our healthcare system, it's not about beds or hospitals, it's about people, professional knowledge and skills. And certainly when it's concerned about specialist nurses, I think that's what we see. We see that we lost lives because we didn't have enough skilled and knowledge people to care for our intensive care patients. We were losing lives because people in nursing homes were not skilled enough to take the protective measures that were really necessary. So it's really moving into knowledge and skills. And So where we are in Europe then, we have that automatic recognition for nurses responsible for general care. So it means that, yeah, some regulated professionals can move from country to country. They're recognized in an automatic way and programs are recognized. What I see, we have the same thing for medical specialists, but we don't have it for nurse specialists. And I think this is quite important. Huh? So the movement is not important. I think that people wants to move from one country to another country, but that's not the main point. The main point, there is no general framework for nurse specialization. And I think the framework is important to really understand what the role is of a profession and what the contribution is. And what I learned certainly from COVID is there is a huge contribution from specialist nurses into the community. So I think this is important. Huh? Now they have to use a general system. I think it's a long way, but it's more important to move forward. And yeah, the new directive introduced something that is called the Common Training Framework, the CTF, to make the process of professional recognition easier. Huh? It's required a common set of minimum knowledge, skills, and competences. I think it's an important instrument that can be used by specialist nurses for the future, in line with what medical specialists did for their specialization. Just go to the common framework very briefly. The condition is that the profession of the training should be regulated in at least 1/3 of the EU member states. I think most of what the specialists are doing is being regulated in most of these countries. I think about oncology care nurses or intensive care nurses, anesthetist nurses, and so on. So in most countries, these professions are regulated. So the condition is more or less fulfilled, and it would be good to know how it really is in Europe and what the status is right now. But if this is the case, then a representative professional organization can take the initiative to start this coming training framework. And I think it might be one of the organizations around the table in our audience, or it can ESNO who can take the initiative. It can be also a competent authority that can do that, but it can also be a national professional organization who can take the lead. And you should not do that by one country or by one organization, but you should involve at least 1/3 of the member states in that way. What you need to do that is to collect some data first. And I think most of the organizations also present today have already done the exercise in mapping what is education, what is professional regulation, what is practice in different member states. So I think it's almost available in most European countries. It's bringing this information together. I think a more difficult thing is the mobility maps. So how people are moving from one country to another country based on a specialization. And I think it's not an easy exercise because people are using the general system. So you have to find out how they do that. But I see that people are moving from one country to another country. So I think this is probably what we should do. It takes a little bit more time to map it out, but I think it's feasible. And so it's a feasible thing that can be done. And then altogether, what we should do is to write a common training framework in terms of knowledge, skills, and competences that is based on the European qualification framework. And I think you should not have an agreement with all member states. You should have an agreement in at least 1/3 of the member states, means in Europe now 9 countries. And that's the general idea. But my understanding at this moment in time of specialist nurses, and it was also what Michelle was saying also in Australia, it's at this moment in time, specialist nurses is not well understood. So it's very different from state to state, from country to country. What are the requirements? What is the education? Sometimes it's supposed to have a qualification. Sometimes it's a master. Sometimes it's not a master. Sometimes it's a kind of continuing education. It would help to have a common framework over there. What is required in terms of knowledge, skills, and competences, that we have a general framework to talk about that. And I like what Michelle is saying. I think it's important to make that visible, also to protect the public. That's our main job and our main reason for doing that. And then there is another condition. If you have done that, it should be that this adoption or that this common training framework would be adopted in at least 1/3 of the member states by a competent authority. And if this is the case, what we then have is an automatic recognition for the qualifications that are requiring these common training framework. Of course, it's applying for all member states all over Europe, and of course, some member states can exempt out of that regulation. But I think this is the way forward. And it's not only the way forward just to increase movement between member states. And I think it was a hesitation, what I understood from our European Commission people that are saying, I don't think that's the purpose. Huh? Because that from a European Commission perspective, this is the final aim. But I think the final aim is patient safety. The final aim is recognition. The final aim is to have this general framework. If we are talking about an oncology nurse, or if we are talking about some specialist, that this specialist is recognized and understood all over Europe in the same way. Huh? And I think this is important. Huh? And we see it also in a medical specialty, that a specialist in one country is understood by a specialist in another country. And I think at this moment in time, it's not fully the case. And it's really hindering us in the exchange and the communication. So this is, I think, a pathway we can follow. And it will take some time to develop that, but I think all the conditions are fulfilled to start with that. So my impression is that the role of specialist nurses has become, is very, very valuable. I think it's becoming more visible and appreciated during the crisis we are in at this moment in time, but I don't see international recognition and a framework at this moment in time. So I think we should push on this and take that lead and to do that. And I think ESNO is in a very good position to lead this kind of change. Thank you very much for your attention.